As a program of the Task Force for Global Health, TEPHANET is a global network of field epidemiology training programs created to train and mobilize the public health workforce across the world to fight the outbreak of diseases like COVID-19. This network consists of more than 70 programs working across more than 100 countries. These programs are designed to train public health workers, doctors, nurses, veterinarians, and other professionals in field epidemiology and other skills to detect and respond to infectious disease outbreaks and other public health emergencies. Every program takes a learning by doing approach, where the majority of the training takes place in the field and enrollees get direct experience providing essential health services to their countries. In an event like COVID-19, FETPs engage in a series of actions before, during, and after an outbreak based on operational guidelines from the World Health Organization.
I'm Nisha Biswal, Senior Vice President for International Strategy and Global Initiatives here at the U.S. Chamber of Commerce. And I'm joined today by three of the leading experts that have really helped us navigate the global COVID pandemic to talk about some of the lessons learned and how we prepare for the next pandemic or health emergency. Jill Schatzberg, who is the Senior Director for Federal Government Affairs at Genentech, Dr. Caitlin Jetelina, renowned scientific communicator and founder of Your Local Epidemiologist, and Lissandro Torre, the Emergency Response Lead at TEPHANET. Thank you all for joining us. And before we talk about the future of pandemics, Caitlin, can you tell us where things stand with the current pandemic?
Yeah, so, epidemiologically, we're in this transition phase right now, and we are going into winter. We know that coronaviruses thrive during winter season, and so we're all kind of holding our breath to see what this winter brings with us. A lot of eyes right now are specifically on Western Europe, where hospitalizations for COVID-19 are increasing pretty quickly. And pretty worrisome is that it's not being driven by a specific subvariant, but rather by weather, by behaviors, etc. There are subvariants on the horizon, though, that we're keeping very close track of that are increasing and that will probably add fuel to the fire. So I think that this winter will be very telling of where exactly we are in this emergency phase of a pandemic. I think it's really also important to recognize where we are kind of socially too. The definition of a pandemic isn't determined by us epidemiologists. It's a global consideration where we think morally, psychologically, and epidemiologically, we all define what an emergency is. And I think each country right now is trying to determine where they are in that spectrum. In the United States, we are in a very weird transition where our hospitals aren't overwhelmed, but we're not in this predictable state. And so this is very confusing to a lot of people. A lot of messages are getting lost to people. And again, it's unfortunately impacting our vaccination rates. So it'll be interesting to see what happens this winter. And we're all kind of at the edge of our seats.
You're so right that this is a pandemic that really has affected us, not just from the standpoint of the epidemiology of COVID-19, the virus, but actually as a societal response to that virus, to that pandemic. And so maybe, Jill, I can turn to you next to, we have experienced this as a society. And so what are some of the key learnings from your perspective that we should be bringing into our preparedness for the next pandemic?
Absolutely. Thank you. I think one of the key things that we've learned throughout this process is that there's no one group or entity or division that's going to be able to tackle this alone. This really requires different organizations in the private sector, the government, academia, all to come together in order to really combat these type of threats. And I think the other thing we need to think about is early preparation. We need to be preparing now for the next pandemic, not just to combat what we're currently dealing with in COVID. And that means building out the appropriate infrastructure, streamlining decision makings, and not losing the lessons that we're living right now. And I think there's a couple ways that we can do that. It involves building out manufacturing capacity, continuing to invest in innovative medicines. We've got two key examples here. One, our mRNA vaccines. Those were in development for years. But had we not continued to make investments in that technology, we wouldn't have a readily available treatment for a new threat. Additionally, I think about influenza as much as I think about COVID. We know we have the tools available right now to mitigate and optimize delivery through vaccines to prevent, diagnostics to identify, and therapeutics to treat. You may have heard of the test to treat pilots that are currently being run in COVID. Those can be expanded to incorporate influenza as well, where you can have a site of care differential diagnosis between these two threats and treat them on site. And then we can learn how these communicable diseases can be curbed as well as severity of disease. So we need to tap into what we have now and plan ahead. The last thing I want to mention in terms of a key lesson learned, we have to take bold action now to dismantle health inequities. We saw from COVID, and we've known from past influenza surges, that globally and in the US, there are certain populations that are disproportionately impacted by these pandemic threats. And so we need to continue to work and strive and collaborate together in order to reduce access barriers so that everyone can access innovative medicines wherever they may be. So those are some of the key broad societal lessons that we need to carry with us as we start planning for the future.
Jill, thank you. I think you raised a number of really important points. And Lysandra, why don't I bring you into this conversation, both to build on some of the points that Jill just made, but also maybe if you could start us off with, the first part of response is really detection, disease surveillance. And clearly, we did not have in place adequate mechanisms for surveillance with COVID. But now with monkeypox, again, I think are seeing that we did not have all of the tools that are necessary to really understand, the early detection and the spread of this virus. So can you tell us what's being done on that front, and then also on a couple of the points that Jill made about additional investments for preparedness?
Yeah, thank you so much, Nisha, for that question. I think, so my perspective is more of a global perspective. So I would say in terms of surveillance and in terms of solutions for detecting monkeypox outside of the United States or coronavirus before, it is that increased connection from the local level to the national and international level. So I think it's strengthening that local response, making sure that the public health workforce is connected to a strong public health infrastructure. I think about the work that we're doing here at TEFINET, where we're building the public health workforce and training frontline epidemiologists to strengthen surveillance systems around the world. What we want to do in the future is make sure that there is that connection to national systems and better communication with international systems. If we have that, it would shorten the time of disease. It would make us more proactive rather than reactive to responses, and allow us to get into address things sooner. I think right now Uganda is a very good example of what's going on, where they have a case of Ebola, and the international response is trying to do the traditional IMS go in and just a whole international response, where Uganda has a very strong public health infrastructure and a strong FETP program and strong surveillance. But what they don't have is fuel in rural areas to make sure that information is passed, that you can go and do outbreak investigations. They're lacking internet sometimes to make sure that the surveillance reports get up to the national level. So in strengthening that type of support around the world, I think will help do that, and maybe shorten the response time, allow us to be proactive and prevent because of our globalized world, prevent disease from crossing borders as fast as they do. Also, like, I think just in the national response, and I would turn it over to Jill and Caitlin to know more, but in the United States, we were talking about it in the winter, and when we started to get the cases, they'd already been circulating in the US for several months. I guess, again, getting that local response in New York, what could we have done to detect that it was there in November when we saw what was happening in China? What was missed there? And I think there are a lot of solutions to be explored. I'm less strong on US, but I think lessons that we're applying in other countries could be applied here also.
That's a great point, Lisandro. And let me turn to you, Caitlin. You know, on that particular point, on how the United States dealt with the surveillance. On the one hand, we have one of the most advanced healthcare systems in the world, and yet on the other hand, you know, we do have a lot of kind of fragmentation in terms of how the cities and states and private hospitals all communicate. How do you see a more streamlined and integrated surveillance system working in the United States?
It's going to be really tough in the United States. Like you said, we have an incredibly fragmented, underfunded public health system. And so the way that data is driven is from the bottom up, from these local organizations to the up. And so what that means is we need to strengthen data infrastructure, everything that Jill and Lisandro said, at the local level, and then somehow connect it all so we can get a national picture of what is going on. And that is a tall order. Because we don't have a national healthcare system like Israel or the UK have. It's not impossible. We need to do it, but it's going to take time. It's going to take investment, and it's going to take a ton of teamwork. So, I guess I'm optimistic, but it'll be interesting to see where that goes. I think the other thing that I've been really honed in about, and really is an umbrella for everything that's been talked about so far on this panel, is the need to strengthen our communication. We need first-class communication. We need to consider it. It cannot remain as the secondary focus in the United States. There have been other countries that have done amazing jobs in communication, like Vietnam, for example, or South Korea. And we really need to translate it into action for a timely response to new threats or even ongoing threats. It's going to be impossible to gain trust with the public without it. And it really needs to be at the forefront of our preparedness. And so that's something that I think will be really important, again, across everything, of surveillance, of data infrastructure, of gaining trust from the public, of everything. We really need to touch on that communication aspect as well.
Absolutely. I think one of the important learnings of this pandemic has been how vital it is to gain the public's trust to provide accurate information. We've seen so much disinformation, so much mythology around the pandemic that has really hampered the public response. You mentioned teamwork as well as we look to the future. And, Jill, I wanted to turn to you on that front, because I know Genentech has really focused on the importance of novel partnerships in trying to address these kinds of crises. And here at the Chamber, we have been all in on looking at partnering differently as we stood up the Global Task Force for Pandemic Response and the Global COVID Corps as examples of public-private partnerships to address these challenges. But Jill, can you talk to us a little bit more about, the kind of partnerships that you're advocating for at Genentech?
Absolutely. And I think we are all on the same page that collaboration, communication are going to be key. One of the things that I found most encouraging during this crisis was everyone that we talked to, whether it was government, academia, others in industry, everyone said, what can we do to help? And that led to new partnerships that we've never explored before. For instance, our bread and butter is scientific research. We want to bring the next innovations quickly. So we partnered with others in industry to immediately set up combination studies of new therapies in order to get those tested and see if they were viable. Additionally, when it came time we did find as industry a potentially viable therapeutic, we had to say, well, how can we help you? We happen to have a manufacturing capacity. So we partnered with an industry peer to manufacture and distribute their therapeutic, both in the US and around the globe, because we could. It wasn't our medicine. It wasn't something we would normally partner with a potential competitor. But in these cases, we came together in order to make that happen. When it comes to these type of novel partnerships, I think we have a lot of different opportunities, partnering with tech companies in order to enhance this surveillance. We can't look in our sort of myopic industry anymore either. We need to think about communications. How do we combat misinformation in the healthcare space by leveraging the knowledge of advertising and communications firms that we haven't worked with before? And this is an area where I am super encouraged about the future, actually. As a result of this effort, we've actually just initiated a new coalition that combines academia, industry, and others called the Medical Countermeasures Coalition, which is designed to advance public policy and coordination for innovative medical countermeasures. So we are starting to stand up structures that previously didn't exist in order to be prepared for the future. And we're looking for new ways to incorporate our non-traditional partners. And so I think that is an extreme positive and something we're very excited about as we plan for the future.
So in addition to having new partnerships, new coalitions, as you referenced, it's also obviously going to require, new groundbreaking technologies that will help us get ahead of the next pandemic before it happens, or the next health crisis. Lysandra, why don't I start with you? What are some things on the horizon that you're tracking that give you hope for how we address future crises?
Well, I think we're talking more. I think that's an important thing. And again, these private and public partnerships are good. And I mean, I just think of the work that Caitlin's doing. Just the communication part is really important, and we're talking about lessons learned, and it's applying it into the next, or hopefully, the next pandemic or next emergency that's going to come. I mean, that's what gives me hope. Is I do just see us talking more, and I see us questioning, at least at the international level, we're questioning how to respond and how to support countries. Again, trying to support at that local level, how to strengthen institutions, not just workforce, how to connect better from the local level to the international. I mean, there's still a lot of work to be done. There's a lot of discouraging things that came from it too, of course. But I think that stepping back and just saying, wow, a lot went wrong, and not having that hubris that we've done everything well. I think that is the first step to really changing how we can do things in the future. Though, I mean, we could say these are lessons that we have to learn over and over. It's not the first time that we've been combated with a huge public health threat, and we said we'd learn, and then we forget later. But yeah, no, I think that's good. It's just like that taking a step now. I agree with Caitlin. We're in a weird time. But it is a time where I think we're looking forward and planning what's next and how to take a breath to see how to improve institutions both nationally and globally.
Caitlin, building on what Lissandro was saying, do you feel like epidemiologists have kind of reinvented or rethought their approach to disease response as a result of some of these lessons that we've learned from the current pandemic? What do you think will change as we move forward?
You know, I don't think epidemiologists have had time to even breathe. We have been overwhelmed, honestly, in the past 30 months, and continue to be with monkeypox and polio and Ebola. I mean, they just keep coming, and this is going to be our new reality, I think. And so I hope that we as epidemiologists are given the grace to have some self-reflection and to really think through this. But I will say I have never been more proud to be in the field that I am in. And we did a lot, and we continue to do a lot of innovative things in the moment. For example, leveraging Google phones to see where people were staying at home or not staying at home and how much community movement there was, and is that driving transmission, I thought was super innovative and in the moment. And another public-private partnership. The other really cool thing that we've seen come to fruition is wastewater. This wasn't new before the pandemic, but is this tool, this passive tool that's incredibly powerful that we can use with polio, that we can use with other viruses that don't determine testing behaviors, for example. And so I, as an epidemiologist, I have a lot of faith in our field. I'm very proud and excited to be a part of them. We just need a lot of help too. And so I also empathize with all of our public health workers right now.
Absolutely.
Yeah, I mean,
Sorry, go ahead, Lissandro.
sorry, I just agree very much with what you're saying. And I mean, the first thought that I had also just like lessons learned for epidemiology. I mean, I just remember when I was working and getting into public health and my first career as an epidemiologist, we go in wanting to do science. And I think that this has taught us that our role, at least in responses like this, is beyond the science, and that it will be influenced by politics, and it will be influenced by society, especially when big things like COVID and polio and monkeypox. And I mean, I think it surprised a lot of epidemiologists that I just want to sit here with my data set and analyze it and put out my reports and maybe publish here and there. But this overwhelming response and large microscope. So in the future, I mean, again, I love that you said, please give us some grace and give us the time to figure out what's next. But it was eye-opening to see that. It's just your comment reminded me of that.
Well, recently I was going to GW Hospital, and I saw this big, massive sign on the outside of the hospital that says, "Heroes work here." And as I think about the role that our scientific and medical community played in the last 3 years in really navigating this unprecedented time, it really does reflect kind of that sentiment of the heroic effort that that came. But as we think about the future and we think about how depleted so much of this community must be feeling by the stresses that they have experienced, how are we in basically replenishing the those front lines? How can we think about strengthening the scientific and medical and health community to prepare for the next series of crises, which Caitlin rightly noted are just a stream, a wave after wave of different things that we can see on the horizon? I'd love to hear from each of you on that, but maybe Jill, let me start with you since you talked about partnerships. What what can we think about partnerships to strengthen our medical and scientific community?
Yeah, I think, well, one of the things that I find really exciting is sitting here with epidemiologists. I'm not an epidemiologist, but I do work in policy and in Washington. And so we are essential partners to work together so that I can give voice to the important work that they're doing. I want to take those reports to the people who make decisions. I want them to make quick decisions and take action so that we can actually translate this into reality. And so if you were to say, what do I want to prioritize? I think one of those things is actually enacting policy that enables our structures to listen to the epidemiologists, replenish the workforce, make the necessary investments. And we've seen legislation proposed in Congress related to this, prevents, for instance, in the Senate. And we know that the PAVA is up for reauthorization next year. Congress is taking notice and they have an opportunity to act. So how do we not only, and not that you guys aren't busy enough, we need to work on combating an existing pandemic, planning for future pandemics, and then the thing that we want to take off people's plate is the structure. We want to be able to have policies, agencies, and coalitions that can actually act on this readily without the stress of having to build the plane while we're flying it. So I think that's some of the things that we're really thinking about for the future.
Caitlin, why don't I turn to you next? How do we build up the reserves to face the next crisis?
That's a good question. I think that low-hanging fruit is empowerment of public health departments, of public health workers. There was a lot of us being the bad guy kind of stuff, us not working with communities, losing trust. There was a lot of politics in public health, at least in the United States, and it was very exhausting. And so I think we just need to get back to public health 101, at least for us public health workers. And again, it goes back to also what Jill just said, is investment. We cannot get out of this cycle of neglect and panic without investment into our public health system. It's just going to be like what we saw with COVID-19 or H1N1 or SARS. It's going to be this continued cycle unless we can get out of it. And so that investment is needed for that frontline force.
Let me turn next to you, Lisandro. Training the frontline responders is something that you're very familiar with. Can you maybe talk to us about a little bit about how we build that surge capacity in?
Yeah, absolutely. I think it goes back to what we were talking about earlier. Is globally, I think the idea of investing in that the public health workforce. So, I mean, obviously, I'm a big supporter of the field epidemiology training programs, but that is building that institutional capacity. It's the workforce capacity, but also strengthening institutions, the national public health institutes. In these countries, connecting the national public health institutes to international systems and programs, again, supporting that field level work so we can, if we have a strong local response, it's done within the context of that locality, so you can be sensitive to cultural differences, right? So strengthening local response allows for a more human response, a more contextual response. And I mean, I know that it's CDC and TEFINET's goal to have a frontline program, which is that basic surveillance program in every country in the world, but also the stronger programs, and then the equitable access to those international opportunities so you can bring knowledge back to your country and strengthen your workforce. In the United States, I agree fully, investment. I mean, public health is now no longer a graduate degree. You see it in undergrad now. We have a lot of people who are interested in public health because of HIV and Ebola, and now because of the ways it affected their lives in coronavirus. It's one of the fastest growing master's degree programs in the country. So we have people that are interested. I mean, something I see, I know CDC has the Public Health Associate Program, which is connecting MPH grads and bachelor's people to local health departments. I would love to see just a massive investment in that so we can get that send graduates to the field to get that local context, to collect data so we can have better data collection. In my mind, I think of an AmeriCorps type thing for public health, where you can get people into communities doing public health work, and then they would support the state and then federal responses. So I think that there's a lot of opportunity, but Caitlin and Jill got it right, where it starts with a recognition of the needs, both in the United States and globally, and then the money behind it and the investment behind it.
Well, one additional point that maybe I wanted to throw into the mix as well is we saw in the COVID pandemic that businesses actually really leaned into the public health needs of the moment. We saw when the deadly Delta surge rampaged through India that the human resources leaders across corporate America, with who had operations in India or Indian companies, all became, in a sense, seized with the health emergency. Distributing home health kits, setting up vaccination sites, setting up clinics, etc., to essentially help augment the capacity of an already overstressed healthcare system. And I think that that's what gives me tremendous pride and also hope that in times of crisis, we find that capacity comes from all different directions to try to meet the need of the hour. And I know at the Chamber, we were very, very proud to be able to bring that capacity forward from the private sector to support the needs both here in the United States and around the world. I want to thank all of you for joining us today. Certainly, we are continuing to learn the lessons of the pandemic. The three of you, amongst countless others, have been there as leaders in helping us understand and navigate the current situation, but also as we prepare for the future, how we can be better prepared. So thank you very much for joining us this afternoon.
Thank you so
Thanks
much.
for having me.
Mhm.
Thank you.